Did you know that 50% of women are unhappy with the appearance of their vagina? That's what we're going to talk about today. And welcome back to the channel with me, your host, Dr. Debra Durst, and my co-host.
Hey guys, Faraday Goli, family nurse practitioner here at Revitalize MD. And like Dr. Durst said, we're going to talk all about the vagina. I think that with the vagina, and we talk about unhappy with appearance, we use that word kind of all encompassing, but really we're talking about what exactly? Internal, the vaginal canal, external, the vulva. What is it that they're unhappy with? What is the survey showing?
Yeah. Well, and it's interesting because, again, we always talk about the vagina, like overall layman's terms is vagina for all of it. But you're right, vulva outside, vagina inside, and ultimately they're unhappy with the appearance of it, which is an external. So they're unhappy with the appearance of the vulva. That's what they're technically saying. And that size, that shape, and actually increasingly color or pigment is a big concern now. And so there's up to like 33% of women doing pigment treatments for
Well,
the
you
vagina.
can do vaginal brightening with lasers.
Yeah. Well, there is a big thing with anal and vaginal brightening now. So, but it's appearance that we're talking about, the vulva. And so, but this is a survey, and lots of the information that we have on women related to women and sexual function or even dysfunction is related to surveys and survey findings. So this was 3,600 plus women that were polled, and 48% of them said that they were unhappy with the appearance.
So we're talking about laxity, so loose skin.
Yeah.
Right? I think that's a lot of it. That's what really has moved labiaplasty over the last, 10 years with leggings?
Yeah. And actually, so that is the highest increase in cosmetic surgery is labiaplasty. And that's significant. It increased by 24%, I think, in the last 5 years. So that is the fastest growing cosmetic surgery that is being done right now. And so that's crazy to think that.
It is.
And I've seen some of those. Obviously, if there's an excess of skin or labia minora, that's a surgical issue. Laxity, obviously any of it, you can have a labiaplasty, but I think we need to know where this is coming from. Like, why are so many women unhappy? What is normal? And what can you do about it outside of surgery? Are there things that are available? So I think a lot of where this is coming from is, again, porn. Like a lot of things come back to, there's a comparison going on, and yes, there's social media, there's friends, there's family, but in a lot of those studies, they frequently would cite porn as a comparison. And there's not being normal.
I don't look like that. Or I used to look like that.
Yes.
I don't look like that anymore.
Yes. And I think that was frequently cited as the comparison was a porn. It's up close. It's personal. They're seeing it and it doesn't look like them. And so it's just not a realistic expectation. So that's, I think, where a lot of it's coming from. But I think there's a lot of younger women that are either uncomfortable, have lots of questions related to their body, to, their vagina, to their sexual parts, that they don't have a good source to go to, because now there is more awareness on social media and digital outlets than there was when I was younger.
Yeah, it didn't exist.
No. And
I mean, we can just, other than porn, it didn't exist.
No, so I don't think there was a lot of insecurity around it, but I don't think that there's a lot of mothers, like at least my age, having those conversations with their daughters, because it just was never thought to be an issue. But anyhow, all vaginas
even access to porn, it was significantly limited then too.
Yeah, well, and
because no internet,
and people weren't on social media talking about comparing vaginas, or so there are a lot of younger women with questions about it. And I think the important thing we need to stress here is that everybody's vagina is different.
Yes, that's what I was going to say. The word normal in vagina, it's so vast. What is normal varies so significantly. It's like a fingerprint.
Yeah.
They're all different.
It's like lips and a fingerprint.
Yeah,
like
they're all different.
Everyone's are different. And so, well, just to put this in perspective, if you have anyone questioning, that, to put it in perspective, I did over 20 years, so over 2 decades in the ER. I did a ton of pelvic exams during that, and never once did I think, oh, that's like not normal. That needs to be improved. Like, so every single one of them looked different. And never once did I think, wow, like that needs to be tighter or changed or whatever. So they're all different, but I never looked at them and thought, oh, they need to be prettier. They just were all different.
They're all different.
And so I would think that just know that there is no other vagina like yours. And it doesn't mean that it is abnormal, normal. It's normal if it's yours. If there's something that's causing pain or discomfort, then that might be something to seek medical care about, or even just seek medical care just to say, like, does everything look good down there? Because if it didn't, they would tell you for sure. Mm-hmm. And so I think that we need to normalize that.
Absolutely.
Vaginas look different.
They look different. And as we age, they look different. Mm-hmm. So as we lose hormones, the tissue changes. Mm-hmm. And if that is what is going, oh, I don't like what's happening, well, we need to replace hormones if we need to replace hormones. And then there's lots of options for tightening.
Yeah. And I think when it comes down to, like, if it's normal, like if it's not bothering you and it's not, young people really don't, like young girls, most of the time it's going to just be a different look and there's nothing abnormal there. Now, there are exceptions to that, obviously, and a gynecologist would point that out when you're getting your usual exams done.
Yes.
But outside of that, as we get older and our hormones decline, there are changes too that are bothersome. Some of them are functional changes that are also affecting daily activities. And some of it is just a look change. And if that bothers the woman, you know, no one's being shamed or guilted into anything. I think everything looks different. But if it bothers you and you want to do something about it, there's options for sure.
And hormones are one.
And hormones are one of them.
Estrogen replacement plays a huge role in vaginal atrophy, tissue atrophy, or changes in the tissue.
Yes. And so definitely hormones and getting your hormones tracked and optimized. And then likewise, there's vaginal laser rejuvenation. Yep. So you can use surface. There is some ablative and non-ablative. Everything we use in the office is non-ablative. So it's just surface heating of the vaginal canal, internal and external on the vulva, which result in all the functional improvement, which means you have urinary control again, you have increased blood flow, increased lubrication, increased, arousal, increased orgasmic strength.
Tightening of the skin laxity, so tightening of the skin.
Tightening of the vagina, because as you have vaginal deliveries, you'll have laxity. So you don't have the friction of, penis against vagina, potentially. That is also contributing to the decreased orgasmic strength. So you can do vaginal laser rejuvenation, surface heating that improves all that.
Yep. And then the lasers can also lighten and brighten.
They can lighten and brighten. And then, of course, my favorite is the laser treatment that we call the Fotona 4V. So it's done with our Fotona laser. You can do a 4D facelift with that laser, but we do a vaginal facelift with that laser. So it tightens everything like I've not seen done with the other lasers that we have. So you can do internal and you can come to the outside and then tighten the external or vulva, which is more of a facelift for the vagina.
And it is a great alternative to labiaplasty. Mm-hmm. So in some cases, labiaplasty would be something we would recommend, but it's very, very rare to have a case like that the Fotona can't handle.
Yeah. I mean, we always want to see and take a look at it, and we can usually tell, and I would say, yes, 95% of the time, a non-surgical option is definitely worth an approach. And we've even had people that have had surgery and labiaplasty unhappy with the results that have done the 4V laser treatment, and been very happy with the results.
And wish they would have done it first.
Yes. And so it can go either way. I just say if there's excess, if you're having pain, if it's a clear surgical issue, otherwise, I personally think that you should always approach things from a non-surgical standpoint, get an evaluation by somebody that does laser vaginal rejuvenation and see what can happen, because it does improve all the other functional things at the same time.
Absolutely.
So there are options out there. And as we talk more about perimenopause and menopause, we also don't always pivot that conversation to say, how does that affect sex? How does it affect the vagina, the vulva? How does it affect me personally? And what can I do to change that so that, my sexual satisfaction and pleasure continues to be high and satisfactory
Yes.
throughout life? So if there's any questions you have, if you've have questions, about sex or the vagina that you've approached your doctors about, share with us just some comments of how those are handled, some options we may not have heard of.
Yeah. What laser treatments have you done, if
yeah.
any? Let us know. Did you have good results? We want to hear.
Yeah, because we are willing to deep dive into anything wellness or sexual wellness. So thank you.